HoLEP is an alternative to conventional transurethral resection of the prostate for the treatment of bladder outflow obstruction. As men get older, the prostate gland increases in size, and that can cause obstruction to the bladder. HoLEP is a modern way of treating that condition. Similar to TURP, HoLEP is performed either under a general anesthetic or a spinal anesthetic, and an instrument is inserted down the penis, and a laser is used to shell out the middle section of the prostate. The main advantage of HoLEP over conventional TURP is that it is less risky. The risk of bleeding is much reduced, and that generally makes for a safer procedure and also translates into a shorter hospital stay. Afterwards, most men have some burning and stinging for a few days. That usually settles within the first few weeks, but it can take up to 3 months to get the full benefit from the operation. In the long term, the only real complication is a 5% chance of a stricture, which is where scar tissue forms in the urethra, and that results in a restricted flow later, usually within the first year. Well, the main advantage is that it's a safer procedure because of that reduced risk of bleeding. The second thing is you tend to remove more of that central part of the prostate compared with other operations which are designed to do the same objectives, which then means that HoLEP tends to be more durable in the long term, and the risk of requiring a redo at a later stage is much less. People get concerned about incontinence, and although in the early stages, some people do find that the sphincter muscles get bruised, in the long term, this isn't an operation that has any long-term effect on continence and doesn't make people leak. People also get concerned about erections. And again, the risk of erections is much less with HoLEP than it is with conventional TURP because there is no heat generated during the procedure with the laser. Most men would need to take it gently at home for the first week or two because in the early stages, often there is some burning and stinging and passing urine relatively frequently. But it's unusual for men to need much in the way of pain relief, and those symptoms will settle on their own. By a month, I'd expect patients to be doing most things, but it's somewhere between 3 and 6 months for men to get the maximum benefit from the procedure.